Monica Healy. Welcome to Pregnancy Chat. Today we want to talk about the exciting developments that are happening with you and your baby during the 19th week of pregnancy. This week, a waterproof protective substance called Vernix caseosa, or just Vernix for short, is developing. Vernix is this thick, white, fatty substance that is secreted by the sebaceous glands in baby's skin. This substance coats your baby so that she doesn't get chapped or scratched by her own finger and toenails. Fine hairs are growing underneath this greasy substance. This growth of hair is known as lanugo. Another important development this week is your baby's hearing. Her hearing has developed so much that baby can hear your voice transmitted through your body, and might even be able to hear other voices during conversations you're having with your friends or your partner. Baby is likely hearing lots of other things as well, such as the gurgling intestinal sounds in your tummy. Inside baby's lower bowel, debris is accumulating. This debris is called meconium. This paste-like substance will form part of your baby's first bowel movement. Although baby pees in the womb, baby does not have any bowel movements until after she is born. The exception to this is occasionally when mom's in labor and at the time of birth, sometimes babies can become a little distressed and have a bowel movement just before being born. Baby's intestines are starting to produce gastric juices, an acidic digestive fluid that helps her digest amniotic fluid that is absorbed into the circulatory system. It's also passed to the kidneys to be excreted by the urinary bladder into the amniotic fluid as urine. Eventually, most of the amniotic fluid that surrounds your baby is made up of urine. Baby's sensory capabilities are now developed and have designated specialized areas within the brain for smell, taste, hearing, vision, and touch. Your baby's weight is about 8.5 ounces and measures 6 inches from the crown to the rump. Her arms and legs are in the right proportions to each other and to the rest of her body now, so baby's really becoming more human-like all the time. Now let's talk about how you're feeling this week. You may be able to feel baby moving, and these first movements are called quickening and feel a little bit like flutters or bubbles bursting. Don't worry if you're not feeling the baby move as yet, because it can take as long as 22 weeks for you to feel your baby move, especially if you have an anterior placenta. And that means that the placenta lies between you and your baby. On this ultrasound, you can see the placenta. It's a large, thick, whitish structure lying over the baby. You can also see the baby kicking and waving her arms. This particular mom is 19 weeks pregnant, and she can't feel any of these movements. We can use a Doppler to hear your baby's heartbeat, much like the instrument your doctor uses on your antenatal visits to hear your baby's heartbeat in the office. It's an amazing moment going in for your first ultrasound and being able to hear your baby's heart beating for the first time. The beat of life right there inside you. As your baby grows, your abdomen will expand and you may experience lower back pain and some abdominal pain. The extra weight gain puts a little stress on your lower back and the ligaments that support your uterus. This increasing weight will continue to increase throughout the pregnancy. Now you're halfway through. This stretching can be uncomfortable, but is nothing to be alarmed about. Do call your doctor though if the pain continues, becomes more severe, or remains painful when you're resting. This is my tip for this week, and it's for you to try and engage in non-stress exercises such as walking, yoga, or Pilates. Look around for classes that are designed especially for pregnant moms that combine breathing, relaxation, strengthening, and balancing exercises. Exercise will help you with circulation, strengthen your heart, and help the lungs work more efficiently. I also really want to stress that the pelvic floor exercise called Kegel Exercises, they were named after Dr. Arnold Kegel, is very important and consists of contracting and relaxing the muscles of the pelvic floor. These muscles of the pelvic floor support your womb, your bladder, your lower bowel. The aim of these Kegel exercises is to improve muscle tone by strengthening the pubococcygeus muscles of the pelvic floor. Basically, this is meant to prepare the pelvic floor for the physiological stresses of the later stages of pregnancy and of a vaginal childbirth. Trust me, after having 6 children myself, I know these things will serve you well during labor and delivery and afterwards. Well, there's week 19. If you have any questions or comments, please let us know or join in the forums. I can't wait to tell you what's happening in week 20. Until then, enjoy this pregnancy journey of yours. These are precious moments that our lives are made of. I'm Monica Healy, and thanks for watching.